Good evening, everyone. Thank you for joining us. My name is Dominic de los Reyes. My pronouns are he, him, and they, them. Uh, and this is the UPAC, or Union of Pan Asian Communities virtual town hall, the first of two in December. And this is an event put on by the uh, program of UPAC called Community Health Worker Communication and Outreach Services. We provide education to the residents of San Diego County, especially Native Hawaiian, Pacific Islander, and Asian and refugee communities that might have a harder time getting access to the information and resources they need to cope with the COVID-19 pandemic. So we are uh, funded by Live Well San Diego. And let's see, it'll be a little unscripted today. uh, we're funded by let's see, sorry. So yes, everyone is welcome to this virtual town hall. And hopefully we can have some good conversations about what our local situation is. We can oh, share some resources. And like I'm sharing my notes. There we go. Getting the hang of this now. um, let's see. And nothing else is on there. Great. Thanks for showing me, my tech savvy buddy here. Okay. Word wrap. I also want to recognize the other people who are helping me with this event because I would be clearly lost without them. Our accessibility coordinator on here tonight is Melissa. Thank you for helping us make this an accessible event with the help of our American Sign Language interpreters, Lori Bellama and Cindy Seto. Also, there are captions, live English captions tonight. So if you would like to see those, be sure to turn them on the bottom of your Zoom screen. So thank you, Jesse Sabanta, for helping with that as well. And our program also has community health workers who speak multiple languages as well. Jeanette Lucas is our Tagalog Filipino specialist, and Tracy Lee is from our Vietnamese communities, and Grace Thaw is also here to assist us with anyone who would like language assistance in Karen. So thank you everyone for helping with that tonight. And I also really wanted to make this a community conversation. There's been a lot of updates in the last few days, and it can be really confusing because of so many things changing. For the last several months, for example, we've been doing a tier system in San Diego County, with restrictions on our, uh, public gatherings and events and businesses and interactions based on the risk level of coronavirus being potentially spread in those spaces. But uh, the numbers have been continuing to go up. And so our local government and California state have decided to put a pause on having a tier system and do a public health order that is telling everyone to basically stay at home unless you're an essential worker or have meet other exemptions. So we can go into the details about that. There are also updates on how everything is coming along with vaccines being developed, right, for COVID-19. Also, we can talk about the differences and similarities with influenza and flu shots and COVID vaccines, who will be getting them first, and timelines and effectiveness and all of that. Jeanette can give a presentation on that. So we wanted to just kind of hear from folks. Um, what are things that you want us to focus on tonight? As neighbors, as community, we're all in this together. And the sooner we're able to equip ourselves and each other with the knowledge and tools and resources to do what we can to stop the spread, then the sooner we'll get out of this. But because it's a viral pandemic, it's something that we all need to work together to um, help our society deal with. So with that being said, uh, Jeanette or Tracy or Grace, would anyone like to um, take over while we figure out what we want to show on the screen and maybe read some comments from Facebook? Um, and also, there is a box for people who are logged into the Zoom. There's a box for Q&A, so you can type questions in there too. You can also mark if you want them to be anonymous as well. No questions are stupid questions, right? We've been in the pandemic for several months now. And, thank you everyone for continuing to be interested in, this conversation. So.
Yes, Dominic, I can share the PowerPoint presentation that I did for COVID-19. Who is getting it first if you want?
Sure, that's fine. And you're able to screen share and everything?
I'll try. Hold on. Can you see it?
Yes, I see. You're screen sharing.
Okay, so this is the PowerPoint presentation that I did, because we are like all of the people or all of my friends are asking about the vaccine, about who's getting it first. So the novel coronavirus vaccine is expected to arrive in San Diego County soon. Distribution of COVID-19 vaccine will be done in phases. The vaccine allocation was determined by the Federal Advisory Committee on Immunization Practices, ACIP, which is advises the uh, Center for Disease Control and CDC on the information about the vaccine. Okay. So the county is expected to get about 20,000 doses of a vaccine made by Pfizer in the next few days after it receives emergency use authorization. Critical care health workers will be the first people to get it. Okay, as other pharmaceutical companies receive emergency use authorization, more vaccines will be arrived in the region. So also on phase one, it will also be given to long-term care facility and residents and employees. Okay, the initial distribution will not be sufficient to vaccinate all people in these populations. However, The state anticipates the second round of vaccine to follow about 3 weeks after the first round. So, if the ACIP Advisory Committee on Immunization Practices approves the remaining recommendation, and once people in the first two groups is in phase 1A are vaccinated and more COVID-19 vaccine doses are available, they will go to essential workers, which is the phase 1B that you can see on the screen. These are people who work in education, food and agriculture, police officer, firefighters, correctional officer, and transportation workers, among others. After that, the priority will be to vaccinate adults, that is phase 1C, with underlying medical conditions and people over the age of 65 because they are at higher risk of developing serious complication from COVID-19.
Ate Jeanette, do you mind pausing real quick
Yeah.
so we can give a chance for the interpreters to switch?
Oh, sure.
Thank you. Just 30 seconds.
Mhm.
Okay, thank you.
All right. So the phase two, this is immunization will then be available for children and young adults under the age of 30. And then for critical workers not included in phase one or phase two. The final phase will be for people of all ages who live in the United States. The phases could be revised as the Advisory Committee on Immunization Practices determines if some groups are at higher risk from COVID-19 and therefore would need to be vaccinated sooner. So the CDC anticipates that by June 2021, everyone wanting to get vaccinated against COVID-19 should be able to do so. So that's the thing that I can share with you about the vaccine. So if you want any further question, you can send a message or through the chat. You can ask question and then we can answer at the end of the presentation. Thank you, Dominic.
Thank you so much. Wow, that was a very good presentation. And in the chat, also, we have shared the coronavirus vaccine tracker put together by the New York Times. Um, if you're interested in information about all the different ones being developed and timeline for that. There's also a page of frequently asked questions on the County of San Diego website for coronavirus. You can also navigate there by going to coronavirus-sd.com. There are actually a lot of updates on there in the last few days. Is there a timeline yet on the phases? Yes. Actually, I wanted to show you a couple slides that were put out by the county that give a little bit of a visualization. Um, let's see if I can screen share now as well. One moment, please. Okay. Let's share screen. May I see what it looks like? Great. Okay, so this is found on the county website with um, recent slides for media updates, and it kind of breaks down the categories of um, who will be getting the vaccine first. And uh, so this is in addition to what Ate Jeanette shared. But as you can see, the people who are healthcare personnel in the long-term care facilities will be among the first to get it. I heard in a county meeting earlier this week that um, children in general and like the general population might uh, expect to have access to the vaccines more towards about halfway through next year. Um, because the vaccines are still being made, they're still being brought to different distribution locations. But with the way that flu shots and vaccinations have been able to roll out across the county with the help of local community organizers finding good locations for different walk-in and drive-in clinics, um, that might be a model for how the COVID vaccines can also start going out so that more people can be trained to give them and it'll be available in many places. Um, and speaking of do people self identify into these categories? Proof that you are an essential worker? Well, yes, it's based on what your job is, and the county has a list of who qualifies as an essential worker. Oh, let me pause my screen sharing for a second until I navigate to that page. Um, let's see. Let's see. Maybe I'll do the full screen share. Okay, so maybe you can come along with me this way. I'm going to the county website for uh, coronavirus, and is it paused? Oh, sorry. Resume share. Here we go. Okay, so this is what the homepage looks like when you type in coronavirus-sd.com. We highly recommend checking it out. You can select any language for it to be automatically translated into. And the regional stay-at-home order here is what gives an list of what's open, what's closed, what's partially open. So you can browse here. Critical infrastructure. This is open with safety precautions. So I'm clicking into that link. This lists, this is a website from this California state government, and it lists who is in the essential workforce as of December 3rd this year. And so just to read here, it says, Governor Newsom issued executive order in March of this year, telling everyone to stay home except as needed to maintain continuity of operations. So basically, there are different sectors where positions of workers are considered essential for the economy to keep running, basically. So, for example, healthcare. It says physicians, dentists, psychologists, mid-level practitioners, nurses, assistants, aides. These types of providers and caregivers are allowed to continue going to work in a physical location, and so they don't have to stay home, right? A number of employers, though, I'm hearing are kind of navigating and negotiating with their essential workers around um, still uh, adjusting work duties in a way that protects the workers as much as possible from exposure to COVID or the risk of exposure. Um, so, for example, Jeanette and I are essential workers, um, but a lot of the things we're able to do from home, such as this virtual community engagement. So, if at all possible, try to talk with your employer and or human resources department, if you have one, around what is the protocol that the organization has that is in place to follow the public health order for the state and the county of San Diego, but also, um, keep workers as safe as possible. Should people still get their yearly flu shot? Yes, if possible. Almost everyone is eligible to get flu shots, and there are a lot of free locations, even if you don't have health insurance. Um, and oh, hold on. I'm going to stop the screen share. Okay. Um, and even if you get a flu shot, um, it doesn't um, help prevent COVID. The two are separate viruses, but it can potentially save resources that uh, so for example, if you end up getting the flu because you didn't get a flu shot, and worst case scenario you end up in the hospital, um, people are encouraged to get the flu shot even if they're not being as exposed to it as in the past because of following COVID precautions. Resources can still be saved for COVID patients, so we don't want to overwhelm the healthcare system. And that's also why the governor has switched us over to like 5 different regions of the state. Let me find that visual here. So we're part of Southern California region now. Okay, resume share. So let's focus in on this one slide. Okay. Thanks for hanging in there. So I wanted to show you this image from the county. This whole bottom chunk of California is what we're included in, and they're looking at the amount of beds in the intensive care units of medical centers and hospitals that are filled with patients. And so if there's a smaller percentage, like under the limit of beds available still for new people to come in and occupy them, then that's kind of like what raises a red flag for everybody to be going into stay-at-home orders. So this is a news update from December 10th. It says that as of December 10th, ICU capacity for the Southern California region is 7.7%. And they're updating that statistic daily. But once we're in the stay-at-home order, which I think started on Monday, around midnight starting Monday, we're in it for 3 weeks. And so when we were in the purple widespreads here for the last few weeks before this week, for example, private gatherings outside were allowable for up to 3 households of people. while using precautions, right? Um, Such as maintaining social distancing and wearing face coverings and, not sharing food and just minimizing risk of spreading COVID, right? Um, but now that we are in the stay-at-home orders, we're not allowed to gather with anyone outside our household anymore, basically. So that's one of the changes. And then another change is um, um, the amount of things that are open and closed. There's a flyer here as well about, sorry, let me fix this real quick. So grocery stores, for example, are still considered essential um, businesses. And so they're open, but at a lower capacity of people allowed indoors. Um, and here's a list of other things that are still open. The thing with the outdoor dining not being allowed anymore is the reasoning behind why the government changed that as well. Because it says here it's only for takeout and delivery or drive through. Is that it's in order to discourage people from going outside of their home beyond what they need to do in order to take care of their health and bodies and like get groceries, for example. So, are there new questions? There are not a lot of beds left. Yeah. Have we hit the wave from the Thanksgiving weekend? Are we expecting the numbers to rise from that weekend? Yes. Long story short, yes. Here is a chart. Maybe I'll make it a little bigger. That is showing a prediction of um, the capacity of the hospital beds in the ICU. And this is kind of by month down on the bottom here. This line, the black line that shoots up, is labeled no action, and it means that our healthcare system would be completely overwhelmed with more people than they have the capacity to take care of in the building throughout the whole county. But and here's this dotted line. That's the maximum resources that hospitals have for beds. Um, with the stay-at-home order being a fixed 3 weeks, and we're already almost 1 week into it, right? They're hoping that we will just barely not max out our healthcare system, and it would be even better for healthcare resources if the stay-at-home orders were extended to 8 weeks, as shown on this chart. So, yeah, this was done by UCSD, and it assumes that people's behavior will be around the same as it was when we were dealing with stay-at-home orders back in March of this year. So I just thought that was kind of a shocking graph. Um, and in the chat, what does it say? Oh, 7:30. Yeah, sorry. Can we can pause now for switching unless you already did? Are we good with the interpretation? Oh, okay, sorry. Thanks. All right. So I know we've shared a lot of information already. Did anyone want to um, speak or share a story or maybe a situation they're dealing with around testing, or maybe sharing a household with people with mixed positivity on their COVID tests? Any questions about symptoms? Any questions about resources available locally? I'll also share that our team here at UPEC has some items as well that we can distribute all over San Diego County. So if you want to connect with us afterwards, um, we have little hand sanitizer bottles, um, and single use masks individually wrapped. We are trying to start ordering thermometers as well, so that people can check their own temperatures and um, have more data to rely on than um, um, if you're entering into some certain buildings where they check your temperature, right? Are there any Facebook comments? No. Okay. There's also an app, a new thing that's kind of already set up on smartphones, like iPhones and Androids, that is an additional attempt to um, help with contact tracing, because it can be hard for folks to remember who they may have been in contact with. So this is software that you opt into. It's voluntary, but and it started, I think, this week, maybe Wednesday. So it's new. People might have a lot of questions about that. It's not a tracker. It won't like track your location, but it is able to tell whether you're around anybody else who also has that app activated on their phone. And you can also put into there whether or not you've tested positive for COVID. So um, the protocol is that after you get tested for COVID, if your results come back positive, it gets entered into a database for data tracking, and then somebody connects with you. They'll probably call, and they help you get resources you need. So, for example, if you need a place to stay while your doctor is asking you to isolate, um, say, for example, if it's 2 weeks, there's a county program called temporary lodging that allows um, you to stay there for 2 weeks and get meals and some behavioral health support and other resources like that if you're eligible to enroll in that program. Um, so it's in addition to individuals working with you for contact tracing. And let's see if I can find the page for that here. I'm going to do a full screen share. Okay. Does this look good? So this is canotify.ca.gov if you want to learn more about this smartphone technology. It can tell you how to set it up on your phone. Um, it's in there, but you don't have to turn it on if you don't want to. But this page will answer all your questions about it. It doesn't share your personal identity, like your name and your contact information. They create like encrypted codes for that. So this website is pretty transparent, right? Oh, I'm sorry. I never resumed my share. Okay, this is what it looks like. I've scrolled down to the walkthrough image on the phone where you go to your settings and then you turn on COVID-19 exposure notifications, right?
Is there a link on any of these?
Um, Here, I'll just copy this link into the chat.
Sure. There's a question in the chat.
Oh. Okay, what's the question in the chat say?
Are there known side effects or anything to worry about when getting the vaccine?
Yeah, the COVID vaccine. Um,
You can share,
Go ahead.
Dominic.
Go ahead.
Yeah, the question is, are there known side effects or anything to worry about when getting the vaccine? Is the vaccine just one injection, or are there multiple rounds like when Hep A vaccine? So the Pfizer vaccine coming to San Diego County is administered via two shots in the arm, and the research has shown that it's about 95% effectivity. And this is coming from County News Center, from CDC, and it says the vaccine is safe, but about 10 to 15% of people may have some side effects such as fever, fatigue, headache, and muscle pain. These symptoms should go away on their own after a couple of days. So once people in the United States start to get vaccinated, the CDC will expand its safety surveillance to make sure the vaccine is working as it should. I hope that answers the question. Thank you, Dominic.
Yeah, thank you. Um, so I'm going to resume sharing and go back to the county COVID website. Other than the regional stay-at-home order, I wanted to share that there are testing sites here. I mean, you can find which one is closest to you by going to an interactive map here and putting in your location. Or if you want just a quick reference based on the day of the week it is, it's here. But double check, I think since the stay at home order started, all of the drive through options of getting COVID tests now are requiring appointments. So once you find a location, it's recommended that you call ahead and see how they want you to set an appointment. Sometimes it's online, sometimes over the phone. But walk in, you're still good. You can just go whenever they're open. Um, Yeah, and then also here's some new information on where you can get flu shots as well for the time being. Tomorrow from 9:30 to 4, Imperial Beach Sports Park Recreation Center. If this is near you, you can get a flu shot. It's free. You don't need to show your ID or insurance. Also, the website san diego county.gov/IZ. There's a lot of information on influenza and resources that you can go to there as well. Yeah, and then where Jeanette was talking about the county news center, they come up with daily updates as well on how the county is doing. So it's saying as of today, actually, we've hit another record, over 100,000 positive COVID cases. So, like Jeanette was saying, we can expect the numbers to go up in the next several days and weeks. Because also, not all of the cases that the county has is reported until a few days in. Because the thing about COVID is that not everyone shows symptoms at all. Some don't even know they have it unless they were to get tested. But for about half of people who do get symptoms, they're contagious about 2 days before they even get any symptoms. Um, and then they only start showing symptoms about 5 days in. That's about the average. But there's also some resources, small business stimulus grants you can apply through the county website if your business has been affected by COVID. So there's information here. There's also a personal stipend program that you can, what's it called? It's like $1,000 check for people who meet the eligibility requirements. Maybe this is it, general relief. So if you are not otherwise eligible for unemployment, for example, you can check out information at HHSA as well. And yeah, depending on the sector that applies to you, there's also a lot of resources on the county website for, um, different groups of people, as you can see here. So for schools, the stay-at-home order does not actually affect the plan that schools in San Diego County have been operating with. So if they're already open, then they're going to stay open, for example. All right, let me see if I can pull up some slides around that. Yeah, so we have about 15 minutes left.
We have a question on the chat, like, is COVID vaccine is free? So it says here, who is paying for COVID-19 vaccine? Vaccine doses purchased with U.S. Taxpayer dollars will be given to the American people at no cost. However, vaccination providers will be able to charge an administration fee for giving the shot to someone. So vaccine providers can get this fee reimbursed by the patient's public or private insurance company, or for uninsured patient by the Health Resources and Services Administration provider relief fund.
Thank you. And I think in the last few days, there was also a question about playgrounds. So, kind of a quick turnaround. I think originally playgrounds were included in the stay-at-home orders on Monday, but then I might be wrong on these dates, but like Wednesday, after a lot of debate about it, they reopened them because they considered the, cost, the benefit of having playgrounds as an option for kids outweighed the potential risk, assuming that everyone still, does the COVID prevention practices, social distancing, wearing a mask, frequent hand washing or sanitizing, and it's really, you want to pay attention to how close you are to other people's mouths, especially anybody who you don't already live with, because it's those respiratory droplets. That's the main way that this virus is spread. So outdoors is a lot less risky in terms of the virus getting passed from one person to another because of good ventilation and airflow. So they're saying really focus on, if you need to be indoors with anyone who you don't already live with, make sure that there's good ventilation, at least, two sources of air coming in from outside, like a door and a window. Get a HEPA filter if you can, and or fans. Basically, you don't want to be around stale air. What are some other, here, this is what I wanted to show. This is the, and maybe, Ate Jeanette, you can share the video that goes along with this to kind of break it up a little bit, maybe. So there's something called a Swiss cheese model or theory of like having different layers of defense against the virus. No one measure is perfect, but if you layer multiple things you're doing on top of each other, then it increases your defense against COVID spreading person to person. So in this image, the virus is on the left and a person wearing a mask is on the right. And then there are all these symbolic slices of cheese in the middle. They're categorized by either personal responsibilities or shared responsibilities. And although, it's really tedious, we've already been practicing the physical distancing, the hand hygiene, the mask wearing, covering your cough and sneezes. These are all really important. And then we just need to hang in there basically for a few more weeks and maybe months while the vaccines start rolling out. So that eventually the more of us who have more of an immune defense with the help of vaccines, the less it will be a problem for everybody overall. So things that are listed in here is limit your time in crowds or in places where there are a lot of other people, a lot of fast and sensitive testing and tracing. We talked about the air filtration and ventilation, right? Yeah, and vaccines is one of those too. Well, maybe since I talked about it all, we don't need to share the video anymore. Sorry.
Okay, Dominic. But I think we have another question in the chat. It says there, how long will vaccine immunity last? So I'll share it. Hold on. So it says the protection someone gains from having an infection called natural immunity varies depending on the disease, and it varies from person to person. So since this virus is new, we don't know how long natural immunity might last. Some early evidence based on some people seems to suggest that natural immunity may not last very long. Regarding the vaccination, we don't know how long immunity lasts until we have a vaccine and more data on how well it works. So both natural immunity and vaccine-induced immunity are important aspect of COVID-19 that experts are trying to learn more about, and CDC will keep the public informed as new evidence becomes available. Thank you.
Yeah, thank you. We can screen share for the CDC website too. I want to share. It's a really good source also of um, information and materials, flyers in different languages too. Let me see if I can share screen. This. Okay. So, Centers for Disease Control and Prevention, right? You can check your own symptoms. This tool here allows you to plug in, you know, what you might be feeling and experiencing, and then it kind of gives you some suggestions for what you can do. Um, if you need to call your healthcare provider, some symptoms are more serious than others. California, right? But then also, if you don't have a primary healthcare provider, you can always call 211, right? And you can get connected with a um, healthcare provider, even um, if you don't have insurance, and it will be free, and that person can help refer you to getting COVID tested. 211 can also tell you which locations are closest to you. They'll help you set up an appointment if you want to make one. And it's in general a really helpful line with a lot of other resources, like helping you with health insurance and behavioral health, housing, food, like basically anything that you're having a problem with. They can probably connect you to resources with that. But as you can see here in this tool checker, it's listing out different symptoms, especially if there are any that are life threatening, right? So I think this is a good tool if you want to start out by not necessarily talking to a live person. Um, and then let's close this. Also, everyone is encouraged to get tested for COVID, even if you don't have symptoms, but especially if you're in a higher risk category. Or if you're living with anybody, or providing care for anybody who's in a higher risk category, right? So the CDC website is listing here different groups of folks that might fall into that. This is also groups of people who are going to be getting the access to the COVID vaccines sooner than the rest of the population because of this higher need. So yeah, just wanted to share with that. Considerations for wearing masks. Yes. Do folks have questions about masks?
Yeah. Yes, Dominic, they have a question about the mask. The question is, for example, after I get the vaccine, do I still need to wear face covering when I'm in public? It says here like, yes, CDC recommends that during the pandemic, people wear a mask that covers their nose and mouth when in contact with others outside your household, when in healthcare facilities, and when receiving any vaccine, including a COVID 19 vaccine. Anyone who has trouble breathing or is unable to remove a mask without assistance should not wear a mask. So, for more information, I share in the chat the link for consideration for wearing mask. Thank you.
Thank you. Forgot my train of thought. I have a video on properly wearing masks. Oh, also, sometimes I see some viral videos about people going into stores without wearing a mask when the store has a policy that you must wear a mask. And Facebook Live question. Good. Well, to finish my point, even if you are medically exempt from wearing a mask, the store most likely has a right to not let you into the store because you're not wearing a mask. So that's where maybe some confusion may lie. What was there was a question on Facebook Live?
I didn't see one.
I'm looking for the question, but I'm not able to find it.
The question, Dominic, is if vaccine is necessary. I am hold on. Wants to know if a vaccine is necessary. I am always allergic to vaccines. So maybe you can answer that, Dominic.
Well, let's look it up. Right, because it's a fact that not everyone will be eligible for the COVID vaccines, and I've been hearing that with the tests of some people trying the vaccines, there are some symptoms that can come up that can be hard to deal with or put some people off. Also, I think some of them might need multiple doses in order for it to work the way it's supposed to. So, that's a question for you and your primary health care provider to discuss whether, weigh the pros and cons of getting the vaccine. In general, the more people that get it, the idea is that, uh, the less it will spread, more people that get more immunity to it than if they were not to get the vaccine. And, I think there's also a few different factors involved in how long immunity lasts per person, right? Sorry about the background noise. I'm going to look around to see if if there's a good website to share on the screen. One moment. And Jeanette, or if anyone else wants to add to that, I know Grace, you haven't spoken yet, but just in case, feel free to share, or Josh as well.
Uh, Hold on. I can share something I found from the frequently Q&A. Um, uh, COVID-19 vaccine, as I mentioned in the early question, if it's safe, it says that it is 95% safe. So for those who have reaction, um, the CDC and the FDA encourage public to report possible side effects or called adverse events to the vaccine adverse event reporting system. So um, the top priority is for safety. So they monitor the safety of the vaccines, and also this vaccine will stop the spread of the virus. And if you have really adverse reaction to the vaccine, maybe you can check, as Dominic mentioned, check with your primary provider the right thing to do. And so maybe Dominic can add more as I'm trying to look more answer to the question.
Yeah, I'm also on the CDC website because they have a lot of FAQ there, but we can share screen. Let's see here. Here we go. Yeah, I mean, you shared a lot already. It said getting back, how many shots will be needed? Two shots. And one of the vaccines uses one shot. If you already had COVID and recovered, do you still need to get vaccinated with COVID-19 vaccine when it's available? The CDC is saying there's not enough information yet regarding how long after infection someone is protected. Early evidence, you may have read this already, and I apologize if this is repeating, but it's just simply not known yet. We haven't really had to deal with a pandemic like this. Since the influenza pandemic of 1918, 19. But even then there wasn't data, and there are a lot of differences between then and now. But even back then, one of the ways they were coping with the pandemic was holding moving events and groups of people outdoors instead of indoors. So they knew there was something to that as well.
I would like to add a little bit about the genetics, about the why do we need COVID-19 vaccines. So according to the CDC, to get the COVID-19 vaccine is very important for us, not only us, but for everyone in our household, our loved one, because getting COVID-19 vaccine is stopping the pandemic. if we would like to start the pandemic, it is good for us to get the COVID-19 vaccine, or when we go outside, we wear a mask and then wash our hands. Just follow the tool to prevent the spread of the COVID-19. So together, we are in the United States together to start the COVID-19. We should get the vaccine and then follow the CDC recommendation to protect ourselves and other like our family or our loved one. Thank you.
Thank you, Grace. And thank you everyone for joining us on tonight's virtual town hall. Sorry, it's a little bit after 8, but we really appreciate everyone for watching us and joining in on the conversation. For any further questions, feel free to connect with us. I'll put the website to our program in the chat and also say it while I type it. It's upacsd.com/programs/CHWCOS, which is the acronym for our program, Community Health Workers, Communication and Outreach Services. Contact information is on there. We're also on Facebook under my name, Dominic De Los Reyes. You can also go to the UPAC Facebook page and find more information there. Thank you so much. And thank you to everyone who helped put on this event tonight. Stay safe. And for those who would like to join us next week, we'll be having another conversation Wednesday, 7 to 8 p.m. Thank you. Bye-bye.